All right, so this is going to be the exam flow for the lung and thorax. I did not have a chance to work with a partner this week, so I'll be using Frank here. So first, I'm going to be looking at the patient's lips as well as their fingernails, noting the color, shape, and condition. Next, I'll be observing the patient's trachea. I'm going to be noting any deviation as well as just the shape or any abnormalities there. I'll instruct them to swallow, looking for deviation there. Next, I'm going to place my fingers on the supratracheal notch, specifically my middle finger, and instruct the patient to swallow again, feeling for the tug again or any deviation. Next, I'm going to be standing on the side of the patient. I'm going to be noting any structural abnormalities as well as breathing patterns. I'm going to take one hand, place it on their upper thoracic spine, and take one hand and place it on their sternum. If this is a female patient, I would have them make a tissue barrier. I'm going to instruct them to take a deep breath in, and then a normal breath in, and again, noting the anterior to posterior chest movement. Next, I'm going to be standing behind the patient, and I'm going to be noting any structural abnormalities as well as for breathing patterns. Next, I will be placing my hands at the 10th intercostal space, and I'll be, and how I find that, inferior angle of the scapula, count down 3 spinous processes, and I'm going to have my thumbs near the spinous. Have the patient take a regular breath in, and then a deep breath in. I should see my thumbs get farther apart and then approximate it after that. Again, looking for chest excursion. I'll be doing the same thing on the front side of the patient. I'll be noting any structural abnormalities or any breathing patterns here. Again, if it's a female patient, I'm going to have them make a tissue barrier. I'm going to take my hands, place them at the subcostal margin, and have my thumbs near the xiphoid process. Have the patient take a regular breath in and out, and then have them take a deep breath in and out, looking for chest excursion. Next, I'll be doing vocal fremitus, I believe. That's what it's called. I'm going to be taking, with the palpation, so I'm going to take a knife edge contact, place it at the upper cervical margin, or the lower cervical margin, have them say 99, 99, 99, and then coming on the sides, 99, feeling for vibration. Next, I'll be having them do it on the front side as well. Again, female patient, tissue barrier. I'm going to be here, 99, 99, mid-thorax, 99, near the xiphoid. I'm going to cross my arms and then come in here, underneath or near the subcostal margin, 99. Next, what I'm going to do, I'm going to take my middle digit and I'm going to place it in between the intercostal spaces, and I'm going to be palpating and percussing. And I'm going to be doing that in a ladder formation, so about 8 to 10 areas. So again, double tap, double tap, double tap, double tap, double tap, double tap, double tap. Again, I'll be doing that in a ladder formation down the mid-thoracic, and then I'll be ending up on the lateral aspects of the rib cage here. And then next, what I'm going to be doing, I'm going to be listening. I'm going to be taking my stethoscope using the bell side, not the bell side, the diaphragm side. I'm going to be placing it starting in area 1 near the upper thoracic, and I'm going to be listening to have the patient take a normal breath in and out through their mouth, and then a deep breath in and out through their mouth, and I'll be testing bilaterally in a ladder formation in about 8 to 10 areas down the mid-thoracic, and then ending up near the lateral aspects of the rib cage. Next, I'm going to be listening from the front, and I'm going to be using the bell side in the first 2 areas, again, near the lower cervical and the anterior side. What I'm going to be doing, again, same thing, in and out through their mouth, shallow breath, and then a deeper breath in and out through their mouth. And again, we're listening for any abnormal sounds and looking for normal sounds. Again, if this is a female, I would have them make a tissue barrier. I'll be working down a ladder formation, again on the anterolateral side of the rib cage. Lastly, what I'm going to be doing, I'm going to take my diaphragm side of my stethoscope again and tangle this. All right, and I'm going to have the patient say, I think it's Scooby-Doo for the first one. Again, going down in a ladder formation. Same thing again in about 8 to 10 areas there. Then I'm going to have them say E for echophony. Again, 8 to 10 areas down the mid-thoracic. And then last one, I'm going to have them say or whisper blue moon, again in those 8 to 10 areas for the ladder formation. Again, I believe that's it. Whatever I missed, I'll add in the critique. And thank you.